Good morning. Thank you all for joining us. I'm Tamara Olt, the Executive Director of Broken No More. Today, we hope to build upon a letter which was a collaboration between Broken No More and the Drug Policy Alliance. The letter is a call to action for lawmakers to oppose failed drug war policies and instead embrace life-affirming, evidence-based health responses proven to save lives and prevent other families from experiencing the devastating loss of the one they love. Over 400 families signed on to this letter. Broken No More is an organization formed by friends and families of those suffering from a substance use disorder. We have lived the trauma of addiction with our loved ones, and we have experienced the devastating effects caused by the drug policies of prohibition and criminalization. Far too many of us have experienced the loss of a loved one from overdose because of these policies. Broken No More was formed with the mission of supporting and promoting more enlightened drug policies that will reduce the stigma of drug use and keep other parents and family members from losing the one they love to overdose. On April 29th, 2012, I lost my 16-year-old son, Josh, to overdose. My world changed forever that day. Since that time, I've worked constantly to spare other families from this tragic loss. I support those who are grieving, started an naloxone distribution program, which has developed into a full harm reduction program. I treat patients with medications for opiate use disorder, specializing in the treatment of pregnant women. But all this is simply not enough. On the eve of Mother's Day, I am starkly reminded that a piece of my heart is missing, and that once again, I will go through this special time without one of my children. Josh died a senseless, preventable death due to our failed policies and the stigmatization of people who use drugs. Josh never reached out for help, used alone in his room, aspirated, and died in the ambulance on the way to the hospital. My shattered soul fights on every day in his memory so that no other mother has to experience this tragic loss. For us, there was no high school graduation, no first day of college. There will be no wedding or grandchildren, and we mourn for what will never be. A few days ago, I had to create this photo of Josh. I don't know if you can see what it says, but it says Joshua Olt, honorary groomsman. And this is for my son's upcoming wedding. Instead of standing by his brother as best man, this picture will be on a table by an empty chair. For these reasons, I must speak out about the injustices and failed drug policies that continue to devastate families throughout our nation. While the crisis impacts all communities, overdose deaths are rising most rapidly in Black and Indigenous communities. As calls for harsher penalties involving fentanyl deaths increase, we must look at what harm this will cause. I oppose the criminalization of drug use and advocate for a public health response, including treatment on demand, safe use sites, harm reduction, and a safe supply. We must stop imposing harsher penalties and filling our prisons with people who use and sell drugs. These laws will not deter drug use and will actually increase deaths from overdose, since people will be less likely to call for help. We all want to see a reduction in overdose deaths, but punishment is not the answer. If it was, then we would not see over 100,000 deaths per year to overdose. Please, we have to take a step back and look at what works to save lives, using evidence-based practices, not caging our most vulnerable people. Today, I call for a drastic change in drug policy in the United States. The time is now. Lawmakers, stop prohibition and prosecution. For all of our precious children, we must turn to sane policies. If we can reimagine progressive drug policy through a public health lens, we can change the world so that not one more beautiful life is taken from us. For our next speaker, I would like to introduce Amy Dunkel. Amy's from California, and she's on the board of Broken No More. And Amy lost her 20-year-old son, Ben, to overdose.
Good morning. Ben was with 3 people when he overdosed. One of those individuals was in a drug diversion program. Afraid of being sanctioned and returned to jail, he would not allow the other 2 to call 911. His intent was never to kill his friend. His decision-making in that moment was clouded by fear of incarceration. In Ben's memory, I created the Solace Foundation of Orange County, the first naloxone distribution program in this county. When my son was struggling with substance use, I had little understanding. A decade of working in the field of harm reduction has taught me so much. Providing naloxone is a wonderful way of showing someone who uses substances that their life matters. In 2015, nobody in Orange County had access to naloxone. I can't tell you the joy it brought me to take reports of friends saving the lives of friends, siblings saving the lives of siblings, and parents saving the lives of their children. This, in turn, opened pathways to conversations. I learned so much about people who use drugs because of naloxone. At the end of 2016, I started to take reports of naloxone saving the lives of people using cocaine. It was the first indication of fentanyl here in Orange County. I was able to purchase and distribute fentanyl test strips before my county was even talking about fentanyl. This speaks of the importance of harm reduction programs within the community. When our needle exchange was shut down in 2018, I saw a spike of infections. Several of the young men I had worked with for years developed endocarditis and sepsis. In response, I purchased and distributed bleach kits and sterile supplies, a humane approach to a public health crisis. For 6 years, I've been invited to a local university to present to all the graduating medical students on treating people who use substances with compassion and dignity. The university called my presentation empathy training. Harm reduction can change hearts and minds, in addition to saving lives. Through my conversations, it became clear to me that punitive punishments push the people I work with further from their families and deeper into the abyss. Jails can be both traumatizing and deadly. The first young man I saved with naloxone would die alone later in a police cell the night of his arrest. It broke my heart. Through my work, I learned quickly that there is little separation between those who use drugs and those who sell drugs. Often, they are one and the same. People who sell drugs are friends, siblings, cousins, co-workers, and sometimes parents. I regularly send naloxone to a local mother. She has 2 boys struggling with substance use and housing insecurity. Her boys keep saving each other. Clearly, they use together. If one were to die, would the other be held responsible for the death? Yes. Sadly, with punitive punishments, that could well be so. A double heartbreak for this grieving mother, for this loving grieving mother. I am absolutely opposed to punitive drug laws. They cost my boy his life. Further, research shows that punitive drug laws do not decrease drug use, drug sales, or overdose deaths. When we talk about arresting those who sell drugs, we must think carefully about the term drug dealer. We must also take into consideration that if you arrest someone for selling drugs, they are quickly replaced and nothing changes. The parents pushing for punitive punishments because of, as they say, fentanyl poisoning, by their own admission, have zero understanding of substance use disorders. The stigma that their narratives evoke silences those with a lived experience, those who could use their knowledge to promote meaningful changes with evidence-based solutions. Harm reduction and science-based treatments save lives. Surely this should be our goal. Thank you.
Thank you, Amy. Next, we'll hear from Diane Carden. She's from North Carolina. She is the founder of eChem for Change, a syringe service program in North Carolina. And Diane lost her 40-year-old son, Michael, to overdose.
Thank you, Tammy. At eChem for Change, we provide healthcare and other services with others in our community, some partners, and see more than 100 underserved individuals in Pitt County every Saturday in 4 hours. eChem is actually Mike spelled backwards, and in some Middle Eastern language means sowing seeds. So we are sowing seeds for change. Mike, my oldest son, after high school graduation, left to study pre-med at a North Carolina university. He returned home 4 years later, having graduated magna cum laude and dependent on heroin. After determining that medical school was probably not in his future, he began treatment for his substance use, and he went back to grad school and graduated in 2000 with a Master's of Science in Rehabilitative Counseling and Substance Use. Michael moved to New York upon graduation and spent the next 12 years working and advocating for the unique needs of people who use substances. Over the years, as I worked alongside him during my many visits to New York, I watched how he interacted with men and women from all walks of life dealing with drug addiction. He taught me the importance of meeting people where they are at without judgment and with hope for the future. Everything I know about how to treat, as well as how not to treat people who use substances, I learned from Michael. During a very stressful period in his life, Michael turned to heroin once again and overdosed and died in 2012 on Easter Sunday. I had made a promise to Michael that in the event something happened to him, that I would use the funds that I would receive as his beneficiary to help people who were like him. The promise I made to my son was not as easy as I thought it would be. It should be easy to advocate for basic human needs, water and food, a feeling of safety, to love and be loved, to have shelter, to be respected, but I found that it's not. The first year, several mothers and I advocated for the Good Samaritan law, which would give immunity to the person who stayed with someone who overdosed and called 911 and saved a life. Many of the mothers had stories of how their child was abandoned by the person who was with them due to fear of arrest if they called for help. North Carolina's first Good Samaritan law was signed by the governor on the first anniversary of Michael's death in 2013, and we celebrated. In our excitement, we wrote articles. We hung posters that said, "Don't run, call 911." We told everyone at risk about the new law and how it would protect them. In the 11 years that have followed, and in our excitement at being able to save lives with this law, we've watched in dismay as much has changed, and the law has not evolved in a way to reflect those changes and continue to save lives. I hesitate now at the exchange to tell our participants about the Good Samaritan law because they will run the risk of arrest and incarceration. First, let me make clear that I never blamed anyone for my son's choices, his addiction, his relapse, or his death. I don't blame his high school friends who shared the first hallucinogenic with him, or his college friends years later who suggested that he try heroin. I don't blame the young man who provided him with the smack that ended his life. I never wanted anyone to pay for the loss of my son. After Michael's death, I found on his phone the number and conversation between him and the friend he had contacted prior to his overdose. I did what I know Michael would have wanted me to do. I called the number and left a message telling him that I forgave him and I hoped that he would forgive himself. I offered to be available if he needed help in the future to take a different path. It never crossed my mind that this young man should lose his life because my son lost his. Substance use is a health issue, and we should treat it like a health issue and not a moral failure. Mother's Day is in a few days, and there will be many empty seats at the table for any number of reasons, be it overdose, death, incarceration, or tough love resulting in family separation. And that brings me to the need to make changes to the current Good Samaritan law and for us to take a really good look at the death by distribution law. Good Samaritan laws were intended to protect people who provide assistance to someone who is ill or incapacitated. And we must broaden our laws to save lives. That's the purpose. We know that this is a health issue and are in support of less punitive laws. Protection should be extended to any drug with no exceptions. We do not support the current approach of tougher criminality and prison for the non-drug dealer who participates in an overdose event. We cannot be quiet. We will continue as family members who have lost someone to overdose to speak out. We want policies that work to keep people alive with compassion, support, and harm reduction. I wish my son was here to advocate for the changes in these laws and save the lives of people who were like him instead of me. He was a strong advocate for this population, and he was a much better speaker than I am. But he is not here. So I, along with many others who have lost someone to overdose on this call, are here to support these changes for all those who were like them. Thank you for your time.
Thank you, Diane. Our next speaker is Susan Osterman from Pennsylvania. She is the founder of the Loma Foundation, and she lost her 24-year-old son, Tyler, to an overdose.
Hi, excuse me. When you lose a child, finding ways to ensure they are remembered and the same tragedy doesn't befall others becomes a priority. I lost my son Tyler to an accidental overdose in 2020. Since then, I've met grieving parents that have lost the children who also battled substance use. It's a struggle no parent should ever have to endure. And it's made even more difficult by those in power in our children's name who push policies rooted in punishment over solutions rooted in compassion and public health. I understand parents are angry, but pushing harsher penalties is not going to change anything for anybody else. It only makes it worse. We're losing people 100,000 a year, and every one of those adds another at least 10 people whose lives are interrupted. Parents who push these laws, I feel, are being targeted by grief predators. Prosecutors aren't going after cartels. They're going after the easy, low-hanging fruit. Just remember, when you want to get revenge for losing your child, that the best way to do that and what they would want is for you to show compassion to others. And the harsher the laws are, the less our loved ones would have gotten treatment. We're never going to end stigma as long as we can criminalize drugs. As people are viewed as criminals, it decreases the compassion in the medical community for them. Tyler had the kindest soul I ever met. He had a giant smile and generous heart that lit up the room when he entered. He was always the first to introduce himself to new students at school, and it became common practice for him to invite strangers into our home on holidays because he never wanted to be alone. About a year before he passed away, he used with a friend of his, and his friend passed away. And he was distraught and grieving for his friend, but he didn't get to do that because he was so terrified that he would be arrested for his friend's death. And I saw what happens to people in this situation that happens far too often. This grief and this fear definitely spiraled him into more use. It wasn't his fault. They were friends, and that's who's being arrested by these laws. These are not cartel members. These are not drug dealers that are targeting people and trying to get them addicted to drugs and take them. These are friends. They're actually compassionate. They don't want to see their friends sick. The overdose epidemic is a public health crisis desperately in need of compassion and proven solutions, not criminalization. Our criminal justice system allows certain privileged people to go free and leaves victims with no real means of restitution or support, and continuously harms marginalized communities. We demand that our elected officials prioritize saving lives in the midst of this overdose epidemic rather than relying on the old ineffective drug war playbook. It's going to take a movement to get this done, and we need everybody. And moms are the ones that can do it. So please reconsider these harsher penalties because it's only adding to it. Thank you.
Thank you, Susan. Our last speaker is Marilyn Reyes. She's co-director of the Peer Network for New York and Vocal NY board member. Marilyn lost the father of her son to an overdose.
Hello, everyone. I am a lifelong resident of the Bronx, New York. I work in the front lines of the overdose crisis. I am formerly incarcerated and a former user, mother, and grandmother, and a person deeply grieving and holding on to my son's pain and grief from the loss of his father. The drug war has impacted my family for generations and has caused generational trauma. My son's father was a great father. He loved his children. He did for his children. He just had a substance use disorder for years, and he didn't deserve to die from a preventable overdose. We miss him deeply, but criminalization will not bring him back. Criminalization will make everything worse for all families, communities across the nation. If criminalization worked, why do we have the highest rates of overdose after the drug war has been raged for over 50 years, which today marks the 51st year of the Rockefeller drug laws that have never worked and never will? My son's father didn't deserve to die, but it wasn't criminalization that killed him. It was the lack of resources. What we actually need is a deep investment and commitment to public health solutions like harm reduction, drug checking services, education, overdose prevention centers, universal access to medication-assisted treatment, housing, and care, rooted all in love. Our families are demanding it now. Our families are demanding it now. We need public health solutions, not more incarceration. Thank you.
Thank you, Marilyn. That concludes our speakers, and now we'll move to the question and answer portion of the conference.
Thank you so much, Tammy. Hi, everyone. I'm Allie Davis with Vital Strategies. I'll be moderating today's Q&A. As a reminder, please feel free to put your questions in the Q&A box. We will get to as many questions as we can. If you do need any follow-up or additional questions, please feel free to email press@vitalstrategies.org. And that information is also in the chat. Our first question comes from Bev Kelly Miller. How do we get legislators to vote for a broad-based immunity in the 911 Good Samaritan laws instead of focusing on punitive measures that punish people on paper for calling and the OD survivor here in Wisconsin? Last year, the GOP legislators passed a law along with some Dems and governor who signed into law a harsher penalty of 60 years for the law instead of 40 years. I lost my youngest daughter, Megan Kelly, to a heroin OD in April 2015.
Susan, would you like to respond?
Yeah, I just want to say that we need more parents to be in front of these legislators. There are lobbies out there that maybe people aren't familiar with, like the private prison lobbies that are pushing these harsher penalties. But parents really do have a voice. We can't forget that this is our government and we can talk to them, and we need to get up there and tell our stories and let them know the harms that these are causing.
I would agree with that. Some of our people have spoken against harmful laws. Amy, for instance, in California. And while Amy was all alone as the voice of sanity and advocating for rational, compassionate drug policy, there was a huge line of parents calling for harsher penalties, for life imprisonment. So we need more people like us to stand up and say we're here. Please hear our voices. We don't want ramping up of drug war tactics, because there's a very powerful group of people who are advocating for all the harmful laws that we've discussed today.
Thank you both. Our next question comes from Mike Ludwig, a reporter from truthout.org. Are you seeing punitive laws introduced or passed in all of your individual states? Are there any states a national reporter should focus on? For example, where legislation is currently moving?
Amy, would you like to speak to that, since California has been moving in an unfavorable direction at times?
Yeah, and it seems that Orange County, where I am resident of, is the worst, one of the worst. We have a drug-induced homicide bill that's been pushed around, and I've been up to Sacramento several times to fight against this. And it's incredibly hard, as a parent who lost a child, to be in a room with other parents who have lost their child, and to be on the other side, standing alone in a room with grieving parents and being made to feel less than. And I feel that I'm defending my son in death as I did in life. He's stigmatized in death as he was in life. And it's incredibly difficult. What I've noticed with politicians when I testify is that they carefully ask the other parents, kind questions that allows them to tell their story, whereas I'm interrogated. And it's just this them and us, and even the media, after I've testified, they only have eyes for the one side. There's just so much stigma.
Thanks, Amy.
Thank you. Our next question is from Annette. How can we reach out to other moms and families who still want a blame-based DEA approach?
Well, that's what we're trying to do right now, is to raise our voices, to get national press, so they know that we exist, that our voices are important, and so the other parents can join us that feel like we do. We can't, and maybe we can reach some of these people that want revenge and so-called justice for their children, if they listen to us speak and hear the other side, advocating against criminalization and why we believe it's harmful. So whenever we speak and we're given press, it helps us, because sometimes we feel you're very alone. And so thank you for today, for everyone that's come, because it's going to help us get in touch with people and maybe change some hearts and minds of people that want ramping up with the drug war, and that may be able to see the light and why we're asking for what we're asking for.
Tammy, thank you so much, and thank you for sharing about Broken No More. Can you tell us how families usually hear about Broken No More and what happens when they first reach you?
Well, the kind of sister organization to Broken No More is GRASP, which is Grief Recovery After a Substance Passing. And we have a large Facebook group and 120 face-to-face chapters where it's peer support, basically just families, loved ones who are grieving the loss of someone to substance use disorder. So we always let them know Broken No More exists if you're interested in advocacy and in learning more. Please join us. Some people aren't ready for that. They're too new into their grief. Some people come out of the gate wanting to make a change, like Susan, kind of like I did. But we just give people their time when they're ready. Everybody grieves differently. Everybody has different abilities and wishes for what they might like to do with their grief. We also do letters to the editor. We go to conferences. We try and make our presence known. We've partnered with Drug Policy Alliance and Vital Strategies that definitely helps us, people become aware of us on a national scale.
Thank you. Our next question comes from Eduardo Cuevas, and he's a reporter with USA Today. How are you seeing shifts in policies in states like Oregon and California, as Ms. Dunkel mentioned, in treating substance use disorders? Do you see a backward national shift, even in Democratic-leaning states that had previously pushed for health-focused approaches and are now moving towards more criminal approaches?
Would anyone like to speak to that?
I just want to say it seems like it's going backwards, and it's pretty terrifying. You know, Oregon had some bold moves and they didn't give it an opportunity to really see what would happen. Oregon didn't move into the fentanyl problem till later, and that's really what increased their overdoses. It wasn't the decriminalization of substances that they did out there. They didn't give it an opportunity to see if it would work. Fentanyl arrived in Oregon much later than other areas, so that's why the overdose rose at that point. So yeah, it's scary. It's like they give it this little chance and then they draw it back if it doesn't work immediately. You know, this took a long time to get to this point, and it's going to take a long time to change things. But criminalization is never, as long as we see people who use drugs as criminals, they're not going to get the services and support that they need. And I never in a million years thought I would be someone here advocating for decriminalization of drugs, but it's a reality. These people are suffering and they need a, health, not jail. Sorry, that wasn't a very good answer, but.
That was great. Thank you. Anyone else? And yes, we are seeing Democrats get involved, which, has kind of been our people to help stand up against some of these harsher penalties. But as parents call for something to be done, for some reason, the only thing we know how to do is to punish and create laws instead of pushing for what we know works. And so Democrats are even getting on board, especially in an election year. So it's super disappointing. And sometimes it feels like we take one step forward, but multiple steps backwards at this point. With like Diane had talked about with the Good Samaritan laws that we fought so hard for all over the country are now basically useless because prosecutors can work around them. And I mean, we know people who've just driven someone to purchase drugs being prosecuted for drug-induced homicide because they drove the person. So there's a lot of craziness going on. And I think we're definitely at this current time going backwards. That's why we wanted to speak and say enough. We have to stop this backward movement.
Thank you. Our next question is from Sandra Chapman with WMBD in Peoria, Illinois. If there was one thing you really wanted people paying attention to the news to take away from today's conference, what would it be?
I suppose I should answer that since this is my local reporter in Peoria. I live in Peoria, Illinois. I just want people to know that there are parents on the other side of this that really want sane, humane drug policies. And we want to do what we know works. Like we said over and over and over, if the drug war worked, we would not be where we are today. Drug deaths have risen exponentially, despite billions of dollars spent, despite harsher and harsher penalties, it doesn't work. We all want to see the overdose deaths go down, as I spoke about earlier, but we have to do it in a way that involves compassion and a health-based approach. Punishment is not the answer.
Would anyone else like to add on to that?
I would just like to add that, you know, if you really want to decrease overdose deaths, maybe we should take some of the money that we're investing in criminalization and put it towards a better mental health care infrastructure. You know, the majority of people who use drugs are doing it because they're self-medicating because they can't access the proper care that they need.
I think some of the reason why we have such a hard time with our stories is that the pictures that depict people who are using substances and overdose, they're not portrayed as, you know, someone's child, somebody's parent, you know, somebody who went to college, somebody who played sports, somebody, you know, that they're just regular people and not necessarily what we sometimes see on the news, that depict people who have substance problems as all the same.
Marilyn, as a longtime advocate, what do you think we can do to help get the word out more and to spread our message?
For me, it's continue speaking out, raise your voices, get more people involved, make a campaign, like continue moving forward. Don't give up, because the fight will change. You just need to keep fighting. It's just that we're fighting against a lot of money.
Yes.
A lot of money. And these people on top don't want to let go of that money. A lot of people are making money over the overdose crisis. So yeah, they want to lock up more people. They want to, just like in New York, we have 2 overdose prevention centers, right? But the governor won't sign for us to have them all in the state, you know, and that's what we need. We need to have them in the whole state, in the most ravaged communities. Like, I'm from the Bronx. I live this, I breathe this, I eat this every day. I respond to the emergency room when someone has a non-fatal overdose and do linkage to care. And along the way, I lose many. And I'm tired of burying my people. It's time for real change. The drug war fails, has always failed. It's not going to be any better with more punitive treatment, period.
Thank you.
Okay, thank you. We have one last question and then I'll hand it back to you, Tammy, to close us out. As a reminder to anyone on the line, though, please feel free to email press@vitalstrategies.org and we'll be happy to forward your questions on. The last question comes from Jennifer Fernandez, a reporter with NC Health News. Expand Good Samaritan, North Carolina just released a survey of registered voters that show over half of all voters strongly agree that saving the life of someone who has overdosed should be more important than catching the person who supplied the drugs. Why do you think there is this disconnect with the voters, with what the voters want versus what the lawmakers are passing?
I think that's you, Diane.
I wish I knew. I mean, everything tells us that North Carolinians want better drug laws. They want safer communities. They want people to be protected and taken care of. They want less punitive action. But I think maybe the pressure from other parent groups, law enforcement, the DAs, have an impact on our policymakers. Wish I knew how we could, you know, turn that around. 13 years ago, you know, everybody was on board. That's why we were so excited. Everybody was on board. Yes, we'll see what we can do. Let's all work together. And then we were going to build off of that. And what happened is it's, you know, just It's just gone backwards.
You know, a lot of it is fear too, I think. We tend to other when we don't want to be one of them, one of those people, you know, we're not like them. So we punish, you know, we have to be different. So let's punish them. But people need to realize that we're all the same. There's no those people. I mean, this can happen to anybody, and anybody can end up in our shoes. And you don't want to be here. I promise you. You know, just remember that those people that you're punishing are just your children too. They're all the same.
Thank you. If nothing else to add, Tammy, back to you for closing. Thank you.
Well, thank you so much for everyone that joined us today, press, concerned families. We are so happy that you were able to share this time with us. As mothers, our hope is that together we can create a better, brighter future for all of our families through love, compassion, and with the realization that no one is disposable. Thank you again.